One of my number one requests for education on general x-ray positioning has been sternums. So in this episode, we're actually going to cover a little bit of sternum positioning how-tos. The beginning of any good positioning is always knowing your anatomy. So what anatomy do we need to see? We need to see the entire body of the sternum. We need to see the manubrium, and we need to see where the clavicles attach to the manubrium. Our protocol is for a lateral and an RAO, which is pretty typical. Now, most exams on sternums that are done on the table turn out absolutely gorgeous, but most patients who have really hurt their sternum can't tolerate it. So most of the sternum exams that we see are done upright, and that's okay. So we're going to go ahead and stand up our skeleton and take these images. My personal trick here is if the patient can place both arms behind their back and puff out their chest a little bit, you actually get a much clearer picture of the sternum. Now, keep in mind, if they really fractured their sternum, they may not be able to do that, so you have to base it on what the patient can tolerate. So we're actually centering mid-sternum. The more you collimate, the better the image is going to be. So just make sure that you have your jugular notch at the top and your xiphoid at the bottom. And the more that you collimate the chest out, the prettier your image will be, especially if you're phototiming this image. Both Merrill's and Bontrager's recommend an SID of 72 inches for the lateral projection. If you have a heavier patient, though, and you're having a hard time getting a very clear image, what you can do is actually move that SID into 40 inches. You're going to have more magnification, so it's not going to be as good of an image, but it might help you with your technique. Taking the lateral on a deep inspiration also really helps you get a good image. It's kind of that same effect as puffing out the chest and putting the arms behind the back. It really pops the sternum out from the rest of the thorax. So of course, that's not what a real image is going to look like. So here's a couple images from Bontrager's and Merrill's. We're not going to have any rotation. That's what we're looking for here. There's going to be no superimposition from the shoulders or the soft tissue from the arms. We're not going to have superimposition from the ribs because, again, that would indicate rotation or that the patient wasn't in the correct position. And a really good inspiration also helps contrast the lungs from the actual bony thorax. So here's our lateral from Pinterest. Of course, that's a good old fractured sternum, and what we're looking at here is a nice free of rotation image. I don't like that they included the spine because we don't need the spine on a sternum image, but other than that, the technique and positioning is really nice. Don't forget, you can always do a cross-table lateral sternum. Maybe your patient's on a backboard, they can't sit up, or there's a lot of motion. That's also a great way to get a good lateral image. Now let's go ahead and move on to our RAO. We're going to oblique our patient 15 to 20 degrees, and we're also going to center at mid-sternum just as we did before. Now 40 inches is the recommended SID for this. You're going to have a much prettier image when you move that tube in from the 72 inches you used with your lateral. RAO tips. For a good oblique, you always have to know where the anatomy would be located in the AP. Even though we don't do an AP, figure out where that sternum would lie, and now you can visualize how to oblique it and still get it on your image. Have the patient stand in a 15 to 20 degree RAO position. If they place their chin in the upper left-hand corner of the image receptor, it kind of helps them hold their place. And if you have them point their toes towards you, kind of have stand opposite of where they will be in the correct position and say, turn and point your toes towards me. And that keeps them from going back to that sometimes gravitated towards PA position that they just want to put their chest flat against the board. We should be doing these at 40 inches SID, always with a breathing technique. That breathing technique is going to make this image beautiful. So if you don't know how to do a breathing technique on your equipment, please let me know and I will be glad to show you because it will make all the difference for this RAO. That breathing technique is so important because it blurs out the ribs and lung markings for such a nice, clear, pretty picture of the sternum itself. So that concludes this episode. If you have questions on sternum images, how to obtain them, what we're looking for, or even how to do that breathing technique, please just holler at me and we will get together for some one-on-one education.